this computer. Good morning. My name's Janet Dewan. I'm a nurse anesthetist and an educator in Boston, Massachusetts. And I'm here with two of my colleagues in Liberia, with whom I've been working for a while. Today is April 7th, 2020, and we're sharing our experiences concerning the COVID epidemic. Let me start by asking each of you if you could introduce yourself and sort of tell how we know each other. Aaron? Yes,
I'm Aaron Sonah, instructor at the nurse anesthesia program in Phoebe. I'm a nurse anesthetist. I also have a Bachelor of Science degree in nursing and also have a Master in epidemiology. I am a member of the International Federation of Nurse Anesthetic Educational Committee. I'm also with the Afro PHC, and I'm the Liberian representative and a senior member of LINA, Liberian Association of Nurse Anesthetists.
Okay, and is Etienne still there? Etienne?
Yeah, I'm around. I'm Etienne. I'm from Rwanda.
Oh, wait, you're not on the camera, Etienne. Can you move over? Can you just share us for a minute? Yeah.
My name is Etienne Sereko. I'm from Rwanda. I'm nurse educator, anesthetist, and a critical care nurse, and epidemiologist. So before we start, I want to make notice that today is the 7th of April, the day Rwanda commemorates the 26th commemoration of genocide against Tutsis that happened in 1994. So beside that, I want to let you know that I came from Rwanda, moved to Liberia as a visiting faculty. Now I spent now almost 3 years working with colleagues from Liberia at Phoebe.
And okay, thank you.
Yeah, I'm Wilmot Fasa.
Oh, Mr. Fasa, hi. Okay.
I'm an anesthesia nurse, educator. I'm the head of the anesthesia program at Phoebe. And I'm happy that this education, these questions that people are trying to bring up, we think is very important and it will help us to go through. Thank you.
Yeah. And I'll mention that I've been to Rwanda and Liberia and met all of these gentlemen several years ago, many years ago actually, with Etienne in Rwanda, and both Mr. Fasa and Aaron Sonah have come to Boston to do a combined educational program in nurse anesthesia education at Northeastern University and Beth Israel Deaconess Medical Center. Okay, so that's kind of how we know each other. We're all in nurse anesthesia education on a global scale. Where are you now in your country with COVID situation? Do you have cases? Are they being tested? Are you able to isolate people? Have you seen any cases at your hospital?
Well, for our hospital here in Phoebe and Bond County as a whole, we do not have a case yet. But in the country, the total amount of persons that have come down with COVID-19 is about 14, of which 8 is an active case. That is, they are being hospitalized. And we have 3 that have been discharged. They were the first 3 that came down with the virus. We also have had 3 deaths. And at present, we have about 10 suspected cases that are being followed up. They have been tested negative, but they still try to follow them up because of the present situation. And where they are being treated, we have about 30 beds room hospital that they are kept in. But for now, we have 8 active cases.
Mm-hmm. And is testing done on your site, or do they have to, is it only done in the capital?
Those are, the specimens are taken from here and sent to the capital. What is done is they have a group called Riders for Help. Whenever there is a specimen collected, the riders take it to Monrovia and be tested. But because we just got a lot of testing kit, so some kits will be sent up sometime this week.
Yeah, same here. What preparations have been made though for COVID? Are you making preparations at your hospital for how you're going to deal with the patients?
For preparation, presently, the hospital administrator, they are all in meeting presently trying to make some contingency plan to carry on some preparation. But what we have been doing here is they have just been doing some using the WHO protocol on prevention. I spoke to the chief of medical staff when he was going to the meeting today for preparation. I was told that they are thinking about reducing some of the preparedness at the OPD. So they are thinking if they could close down the OPD for now, but other contingency plan for preparation they will let us know later.
So it sounds like maybe the anesthesia department is taking a little leadership in this, in the preparations at your hospital? Anybody?
Well, as I'm concerned, I went to the operating room this morning to find Mr. Miller to see whether his anesthesia is part of that plan. But I did not see him. But I think he will be in anesthesia will be included because Miller is the head for the PDF. So we are sure that anesthesia will be part of that plan because anesthesia is considered here as the front liner. They are involved in almost all the activity. They go on the ward, start IG, they go to the emergency room, they go ICU and things. So I think anesthesia will be very considered in going through that exercise.
So what about your situation? We have a problem even in the United States with not enough personal protective equipment, the PPE. What is your situation there? Do you have personal protective equipment to use to protect yourselves?
Yes, for the personal protective equipment, we have a lot here because during the time of the Ebola outbreak, a lot of these materials were brought into the country. And before the different NGOs that work in Liberia left, they decided that they were going to, let's say, epidemic preparedness awareness, epidemic preparedness response team was established at every level. So what was done was in all of the countries that, like for example, International Medical Corps work in, they try to establish like a reserve in the various districts and the various hospitals that just should in case. And so we were able to follow up and we found out that these materials are still intact. They have not yet expired. So when they come to the full PPE, we have the various masks, we have the face shield, and you name the rest. So Phoebe is like prepared if it comes to the personal protective equipment. But where we have problem would be where we do not have a ventilator, but we just learned that patients that are ventilated usually the outcome is not too good. And so we are now taking about all of getting sources of oxygen for patients just in case we have cases.
And so in the whole country, do you have any sense how many ventilators there might be? ICU ventilators, I mean.
Yeah, for the information we gather, it is only one ventilator. Initially, we learned that there was a ventilator at the Firestone Hospital. Or I called the anesthesia provider there today, one of the anesthesia provider, Mr. P, and he told me that the one they had there is broken. So at present, the only ventilator that is in the country is at LY Hospital in Monrovia.
Okay. And could you tell us also a little bit about your source of oxygen? What is your source of oxygen at Phoebe? Is it reliable?
Well, for now, the oxygen source that we have, because of electricity, we won't be able to get the amount of oxygen there is a plant. But because of fluctuation and because of the economic crisis, the generator is not like running 24 hours. So filling those various cylinders make it difficult. So oxygen source is a little difficult. And we have few oxygen concentrators in the hospital. So if we start to have cases, I'm of the opinion that it won't be enough.
And you might have to make some difficult decisions as you look at patients as well. And are you still doing elective surgery? I think Mr. Fassa said they might talk about diminishing it.
Yeah, personally, there's no electric surgery going on now.
Oh, good. Okay.
Yeah.
And I remember that during Ebola, patients were afraid to come to the hospital. Have you had any sense that that could be true again this time?
That could be true. It could be true because the patients that have been exposed to this disease, they really will stay home until they get infected before they go to the hospital, because the three cases that were pronounced there, they died at a local hospital clinic. They did not come. They went at a clinic, but they were there being treated, and they died. And when they tested them before, they found out that they were positive.
Okay, and I wanted to ask Etienne also to make a comment. I know you're following closely how this crisis is being handled in your home country, where your family is, in Rwanda. Could you make a comment on that? How are things in Rwanda?
Yeah, Rwanda is in a total lockdown. So they're implementing really the precautions as it is stated by WHO. They have isolation sites.
Oh.
They have a hospital. It wasn't a hospital actually. It used to be a health center. Now they made it a hospital to accommodate people who test positive. As of today, the number of cases has increased to 100. I think the latest report was 104 cases. 4 of them recovered. Others are still active. They are ready to initiate mechanical ventilation if there is a severe cases. But up to now, there is no severe case reported. What else? I think they are ready. They are testing, and like Liberia, all suspected cases are tested in Michigan only.
So Etienne says there's a lockdown, that everyone is confined basically to their homes, I guess. In Rwanda, is anything like that going on in Monrovia or in Liberia? Is there any quarantine of just normal people?
No, for now we have not had quarantine of normal people, but we saw on the news that the president was going to give a speech, and it is expected that he's going to tell people in Mosurado and Margibi counties that are closer to the capital that they are going to have a total lockdown sometime this week. And so if that is the case, and the cases that we now have in Liberia are confirmed in Mosurado County, but they're going to add Margibi County to them because like people move in and out of Margibi easily. So they are going to add Margibi to them so that they can have some control of the situation, because now we have had about 14 cases.
And one other question I had for, you're all educators, how are you preparing your students to deal with this? You know, you lived through Ebola and you know how to put on protective equipment. What about your students? Are you doing any training with them regarding this?
The students have been, few of the students that are here have been taught exactly what to do. And before as you know, our students are nurses that come back to do anesthesia. And so they went through a training called SQS training, Safe Quality Service. This training was done after the Ebola outbreak to teach health workers in Liberia how to take care of infectious cases and stay safe. So most of them already know exactly how to use the PPE. And it's just a matter of having a refresher for those who are new graduates. But most of our students we now have are old graduates that also have had this training. And for our senior students, as part of our curriculum in clinical principle 3, they are also taught about infection prevention and control and the use of PPE. So especially for the senior students, they know exactly what to do. And for the freshman students, they are practicing in the hospital and they are also being taught exactly what to do when it comes to infectious cases.
Okay. Let me ask a little bit specifically about anesthesia. As nurse anesthetists, do you feel particularly vulnerable to this because of the role you're going to be playing? And how do you protect yourself?
Yeah, there is a kind of vulnerability because that disease mostly attacks respiratory system. And above 80% of our job just about the respiratory system. People come for us. We introduce material in the mouth of people. We do exam, assess patients on their airways. So there is a really high risk of contracting the virus. So the best way is just to implement what is required. Personal protective measurements, hand washing as required, and making sure that the material we are using, they are really treated as infectious material and treat them adequately. Otherwise, the risk is really high compared to other professionals. I think there is no critical care nurses or intensivists. Nurses are taking the role of going all over. They will pray with the mechanical ventilation. If we have a means, they will give up oxygen. If we have a means to do that. And most of the time, nurses they are called in a OR. So they will be overstretched and they will be at risk for contracting the infection if they are not well protected.
And just for perspective, can you give us some numbers on the number of anesthesia providers that there are in Liberia for the population?
I would say we are like 100, let's say 100 or less in the city in Liberia. Okay.
So like he said, we have 100 nurse anesthetists in Liberia, and now our population is around 4.5 million or more.
Mhm.
So like if you try to look at the ratio, it's like if the virus like take over the country, we will be overstretched. Like ATN just said, we are called almost all part of the hospital to work, playing various roles because people look at us as expert. And so it's a huge challenge we feel for us.
Oh, yes. And are there any anesthesiologists in medical doctors who are specialized in anesthesia in Liberia?
Then we'll have one should be at Nima in Nima County,
Uh-huh.
one at JFK. So probably two.
Two anesthesiologists.
Yeah.
Okay. And how many students are in your graduating class this year? How many nurse anesthetist students?
We have seven.
So
Seven.
Okay.
And
Okay,
yeah.
well, then 107 anesthetists. What do you feel is the greatest need you have right now as citizens, as health professionals, and as anesthetists in your country to help you control this disease and respond to it?
let me start off and then my colleagues will come in. I think for one, a few things I look at. So maybe the first one would be oxygen source. Another one would be, since we are dealing with respiratory disease, we should also have a means of checking the SpO2 of our patient, looking at the oxygen saturation in our patients. So I'm of the opinion post-hospital is another important thing that is needed, along with education anyway, to have a lot of information on what to do and what not to do.
How many pulse oximeters do you have for Phoebe, for your hospital? I know you have some.
Actually, the pulse oximeter that we have on the two anesthesia machine in the OR is the only pulse oximeter we have. Like we have PACO, we don't have pulse oximeter like the Lifebox, we don't have anything like that there. Even the CCU that we have, we don't have such thing.
Mm-hmm. And Tim, did you want to say something about that? About the needs?
Yeah, from your question about the needs. The whole country need the possibility for testing, then tracking and the isolation. This is the most important. They increase the awareness. It seems that the people don't take it as serious. When you look at the crowding in the market, there is a need for increasing the awareness. This is from the side of being able to diagnose who is the sick, to whom he went to contact to, and the possibility of isolation. Then in the hospital, we need at least to be able to get enough oxygen. I'm afraid that once the case increase, the oxygen will be a very big challenge.
Okay.
It's fortunate that you are saying that you are no longer using invasive procedures like intubation to provide the mechanical support. But even basic oxygen will be a challenge.
Mm-hmm.
We need devices and the masks to be able to provide oxygen. Like for instance at Phoebe, we have an oxygen plant, but it's not working. Fixing it is not the most difficult part, but fixing it will help the hospital on its own and serve other hospitals in the area. So this is very crucial. And then there is a issue of protecting people, care providers, making sure that they can be helping patients without exposing themselves. This is how I see the hierarchy of supporting the health system as it is. Oxygen, it will be a challenge in Liberian hospitals.
And when you say the oxygen plant, you're talking about an extractor system that's
Yeah, yeah.
yeah,
Yeah.
yeah, not
That's a small piece.
yeah, not stored oxygen. Yeah. Yes, that is. So how can you be helped? What would you ask for if you could ask for aid in at this time?
It depends. From general perspective, we ask for tests.
Uh-huh.
Then from hospital, we will be. I'm talking as an anesthetist. In a hospital, I will just ask for protective material for care providers. The possibility to get what is required to give oxygen and the manage airways when things turn to be severe, at least to be able to provide the oxygen.
Mhm.
Yeah. We should be able to monitor our patient. Like, for instance, you are talking about pulse oximeters. In a hospital where only you count pulse oximeters in OR, what will happen if people need to be monitored outside the OR? We don't know, we just work blindly.
Okay.
We don't know how to give oxygen, only here listening to patients saying that they have difficulty to breathe. We don't know who is, it's just challenging.
It's actually different. We are fighting a war that we can't see our enemy. So it's you don't know who your enemy in terms of this virus. For Ebola, it's actually different from Ebola. So, I mean, this is our concern. And in fact, training will also be good, as it relates to the virus, because for us to have some training to an approach to take, because right now you will find out that we don't have a set up ICU that you will have places where when you have to take care of a patient, you have those material that the respirator and the pulse oximeter, you don't have any of that set up. So you will have to set patient, or it will not be depending on the in the OR. So we actually don't have an ICU system where we can set it up. So I talked with the chief of medical staff. He said they have requested for people from Aurora to come and do some training as to, so I think we will try to get to them so that they can train about. Actually, we want training like how you are asking, or we'll be happy if we get some education material from you concerning this virus, because actually it's new to all of us. Even though we have some precaution activity from Ebola, but because Ebola was a little bit different, we could see them fighting, but this is invisible, so we would want to learn. It's strange to every one of us, and it's risky for us. So,
well, I know you, though, have one advantage, and that's I think you learned a lot of lessons from Ebola.
Yeah.
That can, make this a reality that you can believe. So, do you feel though that you're able to learn from the things that have gone on in first Asia, then Europe and the United States, and learn maybe from some of our missteps in the management of this? Can that guide some of your practice now?
Yeah.
Yes.
I think this whole virus thing started almost like the way the virus situation started in our country. I'm talking about Ebola, where at first people did not know what was it and what was happening, and people did not know that it was transmitted from person to person and things like that. So those various mistakes that we made around the world, we are looking at it and capitalizing on it and trying to build up. Well, as you know, we live in resource poor countries, so some basic things that we are learning and we need to put into place will be a little bit difficult, but we'll have to modify it to our sighting to see how we can be able to best do it to be able to help out.
Uh-huh. Yeah, no, and yes, it definitely, it should not be a surprise that
Yeah.
this is there. And we certainly had a lot of mistakes and misunderstandings in all our areas, and hopefully you can learn from some of those. Are you optimistic about anything? Can you give me some positive words here?
Yeah, when you look at, yeah, we have some hopes, because when you look at the mortality rate, there is a chance that many people will survive.
Mm-hmm.
This is the first hope. The second, we feel like people are really getting involved in finding out what the best effective treatment, the best effective prevention by trying to what? To work on immunization.
Mm-hmm.
And we are learning from what is going on around the world. We hope that having a mask around your nose and mouth can help you to prevent the minimum you can do, just to use your mask.
Mm-hmm.
There are several positive things that we're learning from you.
Mm-hmm.
And you hope that really sometimes this disease might disappear.
Yeah.
The most scary thing is the country lockdown, with the economic consequences in a country like ours, where our economy are not strong enough. But I'm quoting someone who said that people are able to take back life to economic status of the country, but they're not able to take back life to their bodies. So if lockdown is a cost to pay, then I would say that we should implement it.
Mm-hmm. Okay, and to say a little bit about actually our learning together, because it's the age of technology. You alluded to it, Etienne, but what are we doing to share our knowledge? Yeah.
Yeah, exactly. Like you are facing the crisis ahead of many people, and you have more knowledgeable people who try everything. I think it will be fantastic to get new protocols. What are you doing? What does it do? Like, for instance, you are most of the time when you check our TV and the internet, people are talking about the chloroquine. Are you implementing it? Is it helping? So we take those information, but we don't know if it's work. In Africa, especially in Liberia, chloroquine is still available. Is this something people should start thinking about to implement here? So we will really learn and be happy if you can share your knowledge. It's biggest contribution in trying to slow down the mortality and the spread of the infection.
Yeah. Okay, I think, Aaron, do you have any final words that, or Mr. Fossa from Phoebe for all of us?
Well, I just want to say thanks, for getting on to this program. We think it will be helpful for us to give you some information on how we can prepare ourselves, what we have and what we don't have, so that maybe in whatsoever mean by which we can get help, to protect ourselves and protect our patients, who can be good for us. So I would say thanks for bringing all these things, especially when we have respiratory problem. At this time, I think it even help us to start thinking about how we can set up ICU, and even how the country can even, get to know the importance of having ICU and have those material that we can use for our patient when it comes to the time that we're supposed to use ICU material, where we can have to have spaces where we can use this thing. So I think this exercise with sharing this information can also for us to know what for you add to whatever I can get from you and what you can know about our weakness so that we can be able to save ourselves and save our patients.
And I hope you realize we also learn a lot from you, from listening to how you deal with it, because quite frankly, with the lack of personal protective equipment at some of our major hospitals right now, because they didn't anticipate it, we're kind of like a low resource area. You know, people have had to do things that I saw being done when I was in Africa to conserve equipment that we used to just throw away every time we used it. And now we found that you can reuse a lot of those things. And Aaron, you have anything you'd like to add to any of that? Are you optimistic?
Yeah, just to add on to what it just said, I mean, we made it during the Ebola time. I'm of the opinion we'll make it today. And one basic thing is to follow the various rules. Because usually when there is a strange outbreak, everyone starts to learn about it. But as long as you know the mode of transmission, then at least you have an idea where you are, and you can use that mode of transmission to try to break the chain, and then you'll be able to do things. And as long as we follow the precaution and then follow these basic rules, you'll find out that we'll be able to do a lot for ourselves. And one of the things I see is as if we try to compare Ebola with coronavirus, you find out that the mortality rate in this virus is very low compared to Ebola that is almost 50%.
Yeah.
So that means there's a high possibility that we can do a lot if we put in a lot of time to really help people. And one thing I observed before, let's say during the Ebola outbreak, was there were people who were afraid to go into hospitals to work, but their friends and loved one got sick and they went to care for them, not knowing it was Ebola. So I'm of the opinion people may still make the same old mistake. The best place for us to work as health workers is in the hospital, which is the front line, and you know exactly what you are dealing with, and you can use all of the precautionary measures to be able to help yourself and to help the patient, and be able to help people get well, and then go back to meet their family members. So I would just say that people who are afraid should not be too afraid, because even if you say you want to stay home, you may just walk to speak to someone and you still get it from there. And let's just follow the rules as long as we know is the mode of transmission. I think we can be able to help a lot of people up, and then we can be able to do a lot.
Thank you. I want to thank all three of you for your time this morning. It's such a pleasure to have colleagues, and this is truly a pandemic that we're all dealing with at the same time at different stages. And it really shows the unity of the anesthesia community when we can share our information. So thank you very much. And I will actually talk to you all tomorrow on Grand Rounds.
All right. Thank you and have a nice day.
You're welcome. Bye.